2. And welcome back, everyone, to this exclusive interview coming from Singularity University's Exponential Medicine here in Coronado, California. I am your host, Kevin Edwards. Next to me, we have Faris Siddiqui, the CEO and founder of Circadia Health. Faris, thanks for being with us today.
Thank you for having me.
Exponential medicine, a lot going on in the tech world, a lot going on in the medical world. What is Circadia Health doing at this conference? And maybe tell us a little bit about this device you got in front of us.
Sure. I think this is a great platform to meet patients, providers, payers, people that could really help spread the word with what we're doing. Circadia Health is a London and San Francisco-based health company. We provide contactless monitoring solutions to help predict and prevent hospitalization due to COPD exacerbations or stroke.
Okay, so maybe how does a device like this predict someone from going into the hospital?
Sure, so you put the device on your bedside table,
Okay.
And without wearing anything, it would track your motions. It would lock onto your chest, and from that we could derive your respiratory rate. And on the basis of looking at that neglected vital sign, which is respiratory rate, we can predict whether you're going to have an exacerbation or whether you're likely to end up in a hospital.
So what's the value of having, of tracking a respiratory rate? Like, what's the importance of that, and then how does that work if I'm a provider?
Sure. So in general, monitoring breathing rate is not very common, even in a high acuity situation, such as an intensive care unit. The problem is that there's a lot of lack of knowledge around how you could use this metric or vital sign in terms of predicting things like mortality risk, or in terms of predicting things like infections or pneumonia, which might complicate your overall health. Monitoring breathing rate in general is not common practice in hospitals because there's a very low staff to patient ratio, which means a very fundamental vital sign is missed. And this vital sign can be used to predict things like mortality risk or complications after a surgery. With our technology, you put the device on a bedside table, so it's a nearable device, and you can use that to predict if they're going to have a clinical deterioration.
Okay, so I even caught myself there thinking, I was like, wait, don't we always measure our respiratory rate? But no, we measure my heart rate. Okay, great. So respiratory rate is different than the heart rate, obviously. I'm sure they're interconnected somehow. But maybe why is the respiratory rate so much more important than measuring your heart rate?
So it's not so much that it's more important.
Okay.
It's a metric that's not currently tracked at all. So there's no value placed on tracking it because the interpretation and application of that has been looked over by a lot of clinicians and healthcare professionals.
Meditation has been come into play. I know Singularity University's Exponential Medicine conference, they always have yoga in the morning. The whole holistic approach has come into play. And a lot of that focuses on breathing as well. Is there maybe a secret sauce to practicing your breathing and making sure that you are aware of your taking deep breaths?
Yeah, absolutely. I think in general, mindfulness and meditation works. And it's important for people to practice it because it allows you to realign your entire vagus system. In general, mindfulness and meditation can be used as a way to counter stress and anxiety. In terms of a secret sauce, there is no real secret sauce. It's whatever works for you. As long as you can find that inner peace and you can release or distract yourself from some of the worldly things that you might be focusing on that might be driving that anxiety, that's the key.
So Faris, are people buying this to have this next to their bed at night? Why would I go out of my way to purchase a device like this?
So it's a medical device.
And maybe show our audience right here, show this camera over here, this tablet.
So this application is more for a spot checking perspective. For a demo, the idea is it's not meant for general consumer use. It's prescribed by clinicians. So we are going to be submitting to the FDA by the end of this month. By early next year, this will be a medical grade respiratory rate monitor, which will be prescribed by physicians to patients that are at risk or diagnosed with a whole host of different neurological or respiratory conditions.
Okay.
So what you can see over here with the device is this is the device right here. You put this on your bedside table. This is where the sensor lies. So say you're sleeping about an arm's length away from the device. what this will show you when I hit new recording is it will try and lock on to my chest. And if I sit still and I don't speak for a few seconds, you'll see a trace.
Okay, so while you're sitting still and not speaking, I guess that means when I could talk now. And so this device right here, for people that can't see this, maybe people that are listening to this on audio as well, it almost looks like a dish, like a satellite dish. And it looks like it's sensing Ferris's chest going up and down, tracking his breathing and his movements. So Ferris, what you're saying with this is people who are having an issue that involves their respiratory rate, they're being prescribed these devices and potentially will be after it becomes FDA approved next year to track and monitor their breathing. And there's got to be some importance in that as a doctor. So if say Ferris is breathing a little bit too fast and he had no idea, they can maybe diagnose you with or prescribe you a different type of medicine based off your rates, or maybe ask you to perform some different treatments. Is that kind of a fair?
Absolutely. So the idea is to enable measurement of that vital sign and then use that to do early diagnosis, which enables, of course, early intervention or modification of someone's treatment.
Okay.
What you can see over here, by the way, while we were doing that, is so I tried to respire at a higher rate, and anything above 24, of course, is abnormal. It's classified as fast breathing,
okay.
and so it sent a text message to my phone number, and you can program these alerts and triggers. So if it's a patient that is becoming breathless at night, a healthcare facility could set up an alert whereby a healthcare professional would get a notification so they could check on that patient.
Ferris, exponential medicine is so far thinking. It's so much farther ahead, and it's really cool to see something like this that might be instilled by next year. Where do you see this technology going? I know this is specifically just for the patient right now, and I know you work for a company, but you yourself, where do you see this technology going in terms of its immersion with humans in biomed, as well as in the home, as well on the desk, in the room?
So our vision is to have one of these devices in the homes of any patient that has any form of respiratory or neurological condition. The reason being that if you can get data, if you can amass data on these patients, you could really build one of the world's largest biobank of human data, so you can use that to prevent or predict conditions happening even before they happen. And so what our vision is really is to have this in the homes of people, and really to ensure that people can help manage their conditions and really get more control over their health. Because when they go to their clinicians are making decisions at the moment on episodic or spot checking instances. And what we want is a mechanism to unlock that and provide continuous history or monitoring for clinicians to make better decisions over time.
But Ferris, for you yourself, Dr. Kraft today, he says, he pulled out his iPhone 3, he says, this is how fast technology is growing, and now this is outdated. This is brand new technology, but in 10 years that might be outdated by your own company. Where do you see this device looking like and maybe interacting with human beings in 20 years to come?
Well, in 20 years to come, we think that this could become the hub, the health hub, in your bedroom. The idea is several devices could pair to this. So a pulse ox could pair to this, or maybe some cameras that you might have inside your home to monitor your vital signs, or to look at things like sudden infant death syndrome. The idea is to expand the overall utility of different wearables inside your house so that this becomes a hub to unlock or harness more health data.
Ferris, I learned a lot from our conversation today. Thanks for showing us and allowing me to walk our audience through this example today. Interesting. I didn't really know a lot about the respiratory rate, and now you do, and you learn something new every day. But let's have you take one more deep breath and answer this question. Ferris, what is your definition of a real leader?
I think a real leader is a person that is pragmatic. It's someone that can take calculated risks and always rationalizes and structures the operations of 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 a company, if it's of course in the case of building a company. But in general, in terms of being a leader is more about just the operations of a company. It's also about getting or championing a vision and getting people to get behind it. So it needs to be someone that can emotionally connect with people, understand their true viewpoint, and bring that into his own perspective and communicate that across to people.
Ferris, I like the answer. Well, people, for Ferris Siddiqui, I'm Kevin Edwards, asking you to go out there, champion the vision, and always, folks, keep it real. Thanks, Ferris.
Thank you.
Appreciate you.
All right.